Hi there, everyone. It's Hal Feldman. I am here on June 23rd. It is a Tuesday, and I'm here with Mayor Joe Corradino of Pinecrest. Joe, thanks for joining us once again.
It's a pleasure. Good to see you again, Hal.
You know, we always get together when there's interesting and important things to update the public about. And the latest thing is yesterday, I believe it was the city of Miami that talked about having masks not only indoors, but outdoors as well. Can you tell me about why that might have come about and other areas that might be thinking about this as well?
I'm not sure why it came about with the city of Miami. We held a press conference, the joint press conference, Miami-Dade County League of Cities and at the city of Miami, where the city of Miami mayor announced with, I believe, a handful of other cities, Miami Beach, Hialeah, Miami Gardens, Aventura, Key Biscayne, that they were going to a mandatory mask order indoors and outdoors. So it's just in those cities. Miami-Dade County hasn't said anything like that yet. The key is that the numbers are going up. They're going up significantly, and we all need to take personal responsibility for this. Like we've always said, we need to limit our exposure. We need to, when we're out, we need to stay distant, wear a mask, and practice great hygiene. Our businesses also need to live up to the rules that we put in place. Those rules were put in place with the medical professionals and industry professionals. If we follow them, we should be okay. But importantly, the municipalities and the county need to enforce the rules. In Pinecrest, we enforce the rules rigorously, and we just haven't had any incidences where we've closed people down. But they need to do that in other places as well. And so that was the emphasis of the press conference yesterday when the mayor of Miami announced their mask rule.
Got it. And so I'm just going to put a little personal idea into this. You know, I'm thinking to myself, why, when we've already been told it's safe to go out and do things like walking and jogging and sports where you're nowhere near each other, you know, why is it now that we're seeing the city of Miami tell us no masks are mandatory anytime you go outside in public? And, you know, I had this idea that, you know what, people need to be in the habit of doing this. And if it's mandatory the minute you walk out of your own residence, then it's a whole lot easier for people to remember that and for compliance to happen. Because I have at times walked into stores where 98% of the people have masks on, but there are some people that don't. And, you know, you can't expect those stores to police at 100%. So do you think that's some of the reasoning as to why municipalities might be doing this, you know, mandatory masks outside?
I got to tell you, I have no idea. I don't know what was in their mind when they were making those decisions. We haven't been told that from the state or the county yet. Obviously, again, what we're trying to stress is that this is an individual. We're going to protect ourselves if individually we're acting responsibly, right? I mean, ultimately, you're right. We can't enforce this 100%. I mean, and so, yeah, wear a mask when you go outside. Or when you can't be distant from other people. It's just common sense. In Pinecrest, we comply to it extremely well. I mean, you're right. We're getting a handful of, you'll go into a store and see a couple of people without masks, but once reminded, they'll put them on. And that's what the reports our police are getting back to us and through other observations of our staff as they're out and about.
Got it. Okay, sorry for that phone interruption. The next thing I wanted to ask you about is I have parents. Thankfully, they live very close to me, so we've been through COVID times. We've been helping each other out, having meals together. And recently, they've gotten the second wave of concern where, you know, before we would have meals and talk and we wouldn't have masks on, and now they are deeply concerned about the minute we're not eating something or drinking something, they want masks on. And you know what? I understand it, and I'm trying to comply, and it's really difficult because we have been, you know, kind of quarantining and working together for many, many months at this point. But now there's this new level of concern, so that's what they're asking us to do. Have you seen anything like that personally? What are you doing at home, and how are you interacting? Because I know you've been very good about not going into the office, really not shopping, having everything delivered. So tell me how things are happening personally for you.
Well, it's pretty much the same thing you say. I have parents as well, and you know, we see each other, but we're distant. Right. And we try to wear the masks when we can, which is almost all the time. Again, masks are the one thing that really keeps us safe, as well as staying distant. We're comfortable with getting together because neither I nor the folks in my family, immediate family, are really out and about on a regular basis. So we've confined ourselves to a small circle of people that we see, and we never really get close to them, and we try to wear masks as frequently as possible, and so we're comfortable with that. But let me tell you, the numbers are off the wall, Hal. We have more people in the hospital today than we ever had on a single day during this whole event. The next highest day was in early April. And so this disease hasn't gone away, just like we predicted. It is back. It is more vigorous than ever. Unfortunately, now the main demographic that's getting it are people from 18 to 35. And, it is with us. We have to be smart. We have to stay distant. We have to wear masks, and we have to practice great hygiene. And it's up to us as individuals. Nobody else can do it for us.
I can only assume the conclusion between 18 and 35-year-olds, and that being where the cases are most being seen now, is because those are the people that, hey, I've been cooped up for almost 4 months at this point. And those are the people that are saying, you know what, it's worth the risk to go see some friends or get out into the mall or whatever they're doing. And so they're the ones that are having more exposure, and therefore that's what you see, higher cases in those that are exposing themselves to additional people, right?
I met with the state hospital, the Department of Health yesterday, and their conclusion was that a lot of the numbers we see, there's a segment of the population that's utterly disregarded social distancing. The young people, to a large extent, believe that this didn't impact them, that when we lifted the restrictions that this disease was over, and just haven't paid attention very well. And now the disease is back full force, more than it's ever been. And if we don't take personal responsibility, this is going to get worse and worse and worse. The only good news that we have to present to you is that the hospital system has ample capacity. The CDC guidelines say that we need to maintain at least 30% capacity or a 70% occupancy rate. Right now, we're below about 22% occupancy rate in the hospital. So we have plenty of hospital capacity, but those numbers are eroded every day, particularly when you have upwards of 700 people in the hospital like we do today.
Got it. And, obviously this is a very serious subject, but just to have a little bit of fun with you and our audience, behind me, I've got a virtual background. It's the pool that we have been talking about it. At some point down the road, when everything gets better, I'm going to have you here. This pool, as many, are now open, but with restrictions. And the restrictions are, I'm sorry, Joe, no visitors. It's only people that live here have the access to that. And I think that's smart. We personally saw a whole bunch of people racing out there as soon as it was a couple of Mondays ago when that restriction was lifted and we could get out and open our own pool. But I think that people are respecting the fact that they can't go out there and use the pool like they used to. Our chairs are probably 12 feet apart from each other, unlike what you're seeing in the picture here, which was taken prior. And so, do you get a sense, yes, there's a resurgence. Do you get any kind of sense, do you have a personal belief as to when we might be able to get back to more normal times?
No time soon, Hal. We will likely be in this condition for months. We're not thinking about going forward at all, where there's been no discussion of moving to a next phase. We're meeting only one indicator that would allow us go to a next phase, and that is hospital capacity. Every other indicator is regressing at this point in time. And so for the foreseeable future, we will continue to be with the exact same rules we have now. And if the hospital system erodes and people don't start respecting the social distancing, in a few weeks, there's a very good chance that this goes and takes a step back, which is economically devastating. But we got to preserve the hospital capacity.
All right. I do want to ask one final question. A lot of people that I talk to, they're fed up with social media. Social media is, negative and forcing people down paths of misinformation. Those same people are saying, the media is out to essentially, make this bigger than it is. What do you say to those people, and where do they turn to for accurate information that isn't scaring them?
I think the accurate information might scare them. There are over 750 people in the hospital right now, and the numbers are going up. These are facts, and they need to go to the Miami-Dade County COVID website and look at the dashboard that they have there and look at the everyday incident reports that are there. And those are the statistics, unvarnished statistics through the hospital report. And those are the numbers that gives you the trajectory of the disease and the capacity of the hospital system. And so when we analyze the numbers as the Village of Pinecrest, as the Mayor of Pinecrest, as the Village Council, along with the Miami-Dade County League of Cities, every other city in Miami-Dade County, we're looking at the facts. And those are what they are.
Not pretty is the short answer. Joe, thank you so much. You know, obviously, I appreciate your time. I love talking with you. You're a great person. And I'm hoping
Thanks.
we don't have to do these too much longer, but it sounds like from the numbers and what everybody is seeing in the League of Cities, this is going to be here for a while.
Yeah, we're in this for the long haul, Hal. This is the disease is as it was in early April, and so we've lost a significant amount of time, and so we're here for a while. We need to start to recommit ourselves to those things that got us to the very low numbers that we had just a few weeks ago.
Jeez. All right. Again, thanks, Joe, for sobering numbers, but they are important numbers. You want to give out your phone number and give thanks to those that need it?
Yeah, I appreciate it. I know these are tough times. The Village of Pinecrest is working together, staff, the elected officials, every day on this problem. We're trying to educate people. We're trying to make the changes to the policies that we need to on a daily basis. So anybody that needs to contact me at 305-606-2364. We're here for you. We know it's tough. We know that this is wearing on everybody, but we need to stick together on this one and fight through it.
Once again, thank you so much, and we'll see you next time it necessitates.
Thanks, Hal. Good to talk to you.